Dr. Kennedy, we've only been working for a short period of time. We've both been in practice for a long time, almost 50 years between us, which...
Speak for yourself.
Yeah, it's hard to believe, but...
I'm just a young guy.
You're utilizing a technology that I've not really been exposed to too much over the years, but I'm fascinated by it. I'm actually using it myself because I've got some issues. But can you tell me a little bit more about the spinal decompression technology?
Good question, and yes, you do have issues. Long-axis spinal decompression, it's been around since the 1970s. It's a fantastic procedure. Back then, it was developed by orthopedic surgeons, and they were in an alternative to doing back surgery to, take out someone's disc or put wires or screws and nuts and bolts in there. We've seen everything inside people, and the spinal decompression was an alternative to that, and insurance really never got covering it, and the orthopedic surgeons are so covered up with doing surgery that it kind of lost its success, I guess, in bringing it to the public. So chiropractors in the 80s and 90s got a hold of this, and with some extra training, you can, in our office, you can utilize this. It's a medical procedure. So not all chiropractors do it. So that's the confusing thing is people say, well, I'm going to my chiropractor, but it's actually developed by orthopedic surgeons. And what it does is it actually decompresses the disc. So as discs are degenerating and they're losing their ability to hold the water, that they basically it's like a dried up sponge, and it starts to compress. And when it does that, it starts to compress nerves. People feel pain. They have trouble walking, and they're getting closer and closer to needing to have an operation.
Right. So this is something for someone that's had a problem for a long time. It's getting pretty significant. Sometimes these people don't even know they've had the problem. Isn't that true?
It's true. The discs don't really have a lot of nerve fibers associated with them, so you can stick a knife in there and they don't hurt so bad. But when the disc degenerates enough, it starts to hurt the spinal nerve, and that's when they develop sciatica or muscle spasms. So it doesn't have to be there for a long time. It could be a traumatic thing that brings it on quickly, but the spinal decompression is the best alternative to any type of aggressive procedure, like having injections in your back, being on medication all the time, which messes with your brain function, or having a surgical procedure. It works great. The statistics nationally is it's about 75 to 85% successful at preventing disc operations.
And that's huge. And the patients that I've talked to that have been getting the decompression are getting great results with it. So I'm looking forward to it for myself also.
Me too, because we can't have you bent over. You'd be an ugly-looking chiropractor.
It's not a good look, no. If you've got more questions about long-axis spinal decompression, call the office at the number listed below, or go to the website and click on special offers for decompression, and we'll get you the information to see if you'd be a good candidate for that procedure. Perhaps it could help you prevent an unnecessary surgery. So give us a call.